Continuing to take your calls now regarding lung cancer and lung cancer treatment. Joining us now, Dr. Ziv Gamliel, Chief of Thoracic Surgery at Medstar Health's Angelos Center for Lung Diseases. Thank you so much, Doctor, for joining us.
Thank you for having me.
We're going to talk about risk factors. I'm going to assume that smoking is still one of the high risk factors on the top of the list.
That right.
What are some of the other risk factors for lung cancer?
So any inhaled carcinogens is going to increase your risk of getting lung cancer. As we know, some of the first responders from 9/11 came down with it, but vaping is a really important cause that people aren't aware of. People think that it's safe to use an e-cigarette, whereas it isn't. There's lots of cancer-causing substances in e-cigarettes, and so vaping is absolutely not recommended. Inhaling radioactive gases like radon that can be found in people's homes, particularly in the basement, is also a risk factor, and certainly a well-known one is asbestos exposure.
You're looking at our phone bank on Studio B, experts from Medstar Health taking your calls. So if you have a question, give them a call. The number to call is 410-671-0702. So doctor, talk about some people. Are they more at risk than others for lung cancer?
Certainly smokers are going to be our #1 high-risk group, and anybody who's been exposed to any known cancer-causing substance is going to be at risk. We also have some familial clusters that we see sometimes that we don't really understand. We don't really know why it seems to be hereditary in certain cases, but certainly I think that if anybody is interested in reducing their risk of getting lung cancer, just limit or eliminate your exposure to known cancer-causing substances.
So, I mean, can it be prevented? You hear these rare cases where young people who were never smokers get lung cancer. Is there anything that you can do to prevent it other than the healthy lifestyle and not smoking?
I wish that there were some way to guarantee that a non-smoker isn't going to get lung cancer, and there is no guarantee that a non-smoker is going to be safe from lung cancer, but certainly smoking is a good way to increase your risk dramatically. And I think that rather than worrying about eliminating risk, if we just are smart with our lifestyle choices and avoid exposure to known cancer-causing substances, I think we're going to be all right.
Warning signs?
So lung cancer has many warning signs. Unfortunately, with lung cancer in particular, those warning signs show up too late. And if people are inclined to wait until they have a warning sign before they seek medical attention, chances are it's going to be too late for them to be cured of their lung cancer. We really want to use screening to detect lung cancer rather than wait for any clinical signs.
All right, Dr. Gamliel is going to be with us coming up in about 30 minutes. You can see this complete interview on our YouTube channel, but coming up in 30 minutes, we're going to be continuing the conversation talking about improvements in treatments for lung cancer and lung cancer surgeries. So we will be right back.